Tēnā koutou katoa, ko Margriet Koingoa, and as mentioned, I'm the Sustainability Development Manager of Northern District Health Board. But today I'll be talking more in general about DHB carbon emission profiles and on a high level what action is being taken. So what do we know? We know we need to be carbon neutral in 2025, but what do we really know about emissions and can we actually get there? We've already heard we're the biggest emitter, but I think we've also been early adapters in emission reporting. I need to press. Yep. So over the last 10 years, more and more DHBs have been starting to report their emissions. So at the moment, we've got 12 DHBs, of which we've got an emission profile. But because we've got most of the largest DHB, we actually have got 85% funding coverage. So we've got pretty good insights now on what the profile looks like. Luckily, also over the years, we've seen a growth in DHB sustainability managers working on a mitigation action. And it's not only sustainability managers, we've also seen a growth in energy managers. So there's 5 now, also a lot of them with co-funding from ECA. And waste minimization roles that have been established to actually work on a broad portfolio of reduction. So what we did is we just combined the 12 emission inventories that we have and combined them all together. And we've got a lot more detail in different categories, but today I'll just be talking on this one graph. And what we can clearly see is that gas, followed by coal and electricity, are a big part of the emission profile that we've got. It's also good to understand that those gas emissions, which are the largest, are the combined emissions of 10 DHBs. The one from coal is from 2 DHBs. So you know that once you burn coal, it's going to be a significant portion of your emission portfolio, usually 50 to 60%. Luckily, there has been some quite good progress, which has already started years ago from 2013, converting coal boilers, and there are some really big projects going on at the moment with a new energy center in Christchurch, Ashburton, another Canterbury Hospital, which will be converting to heat pumps. So I think we will see that over the next couple of years, especially also with the focus to get coal boilers out of hospitals. There will be quite a significant reduction there. If we look at gas, I think 3 years ago, it wasn't really something that was seriously looked at. Gas boiler conversions. I think it's only now that that awareness is starting. A lot of DHBs have joined ECA now in running the Energy Transition Accelerator program, but we just tried to map all those energy emissions from gas, coal, electricity, but you also see in the far right corner here, we've got some diesel, LPG, refrigerants, and biomass emissions to sort of have a roadmap for the next 5 to 10 years to know what we got in boiler and consumption, what it's going to cost to move away, and what technologies we can use for that. You were not going to talk about this too much, Paul, right? But basically what we see is that 2/3 of DHB profile is in energy, which means our buildings. And also looking at the future with major building developments, it has to be zero energy and low carbon moving forward. And Debbie and Ian and Ben will be talking on that a little bit more. But after that, it's staff flights. We see some significant differences within different DHBs, and usually the questions are around senior medical officer flights and continued medical education flights. And although we don't have a lot of details on every DHB, but we sort of noticed for the DHB that did report those separately, that usually accounted for half of the DHB's flight emissions, or another way to put it is the senior medical officer flight emissions are higher than the fleet fuels of all the DHBs combined. After flights, it's medical gases. You've probably heard that over the years, a lot of theatre anesthetic teams have done an amazing job in phasing out desflurane. But if we see what's left now, 98% of medical gases is nitrous oxide. It's being used mostly in Entonox for pain relief in maternity and ED. And there's not a lot of technology options yet to get rid of that stream. So that will be quite a difficult one. On the other hand, if we move to the one on the right of that, fleet fuels, there is some really good developments going on in that space. I think the ICA funding or the state sector funding is a game changer that enables DHBs to convert their fleets. And a lot of DHBs are also looking at fleet optimization, travel plans, active transport, e-bikes in their fleet. So I think there's quite a bit of development in that space. Patient transport by road and air, that's a group that usually is reported more on by the rural hospitals. So that means all the helicopters, fixed wing flights, ambulances to transport patients between hospitals. But the biggest part of that is actually national travel assistance claims. So that's patients that need their healthcare in a different hospital somewhere else, and we reimburse them for the car that they drove to get to those appointments. Which is also quite a difficult category to address in the next 4 years. Next to that is waste. Gosh, what to say about waste? It's I see positive developments. I see there's more product stewardship coming. A lot of DHBs have joined the single-use medical device pre-processing from MedSelf. So there is some really there is good trends going upward, but it still feels like we're scratching the surface on that one. I think we've got 300, 400,000 products in our catalog, 97% imported. So it's, going to be a difficult one. So if we look at, what did we learn from this? We've heard it all before. Measurement is management. And I do think that the DHBs that have an inventory have got a more targeted approach. The flip side of the coin might be, are we not managing what we're not measuring? Procurement, Rick will be talking on that one a little bit later. Staff commutes, big emission source. Patient travel, really large significant emission category where I personally feel the biggest benefit is in all better patient outcome, reducing emissions, health equity. But I think for the first time, we've got insights on how we're doing and who's doing well. We also see differences between different DHBs, and I think that's why it's really good to, with the new Health New Zealand organization, to have a better coordination between all the best practices that are happening around the country by establishing a program. And I think then, the million or multi-million-dollar question, will we be carbon neutral in 2025? There's definitely accelerated progress. There is more funding. I think there's good progress, as mentioned, coal, fleet fuels, other areas, but there will also be still significant, difficult areas, as mentioned, nitrous oxide, helicopters, flights. Then will we be zero waste? Will we have zero flights? I think time will tell over the next couple of years, but I think it would be optimistic to even think that we would have halved our emissions in the next 4 years. And it's always felt over the last 8 years, every once in a while, this cartoon pops up again in my LinkedIn feed. And last week it popped up again. It's actually a cartoon from 2013, although it runs till 2019. But for me, the feeling is that in 2021, I think the microphone is on and we have started the race to zero. Thank you. Aotearoa.